have this conversation across disciplines. I think this is very important, and I'm very grateful for that. So I would also like to thank, when you came in, we had criminology students that assisted us this morning. They were very eager. They were also very eager to be yesterday's event where the college co-sponsored the Human Trafficking Summit. So I'm very grateful to the department for that. This is very complicated to put together. I thank Patty Cleveland, Lisa Eisenbeck, and their teams for coming together and doing all the logistics to make sure that we run smoothly today. I'd like to thank our panelists who I've met. They're very, very impressive. I think we'll have a very lively discussion and very informative presentations today. This morning, the panel will be moderated by our very own Dr. Dwayne Smith. And so I don't want to miss a word of his bio, so I am going to read this. Please bear with me. Dr. Smith is a professor, senior vice provost, and dean of the Office of Graduate Studies at the University of South Florida. He received his BS and MA degrees from the University of Houston and his PhD from Duke. Before his appointment at USF in 2000, and he came here as chair of the Department of Criminology, Dr. Smith is a faculty member and chair at Tulane University and the University of North Carolina at Charlotte. He was named Vice Provost for Faculty and Program Development at USF in July of 2005, and he was appointed as Senior Vice Provost in January 2008, and in August 2013, if it wasn't doing enough, his assignment was further expanded to serve as Dean of the Office of Graduate Studies. Dr. Smith's work specializes in the study of criminology and deviant behavior. His current research looks at the analysis of jury decisions on death penalty cases in North Carolina. His past efforts have focused on the dynamics of homicide offending and victimization among specific populations within the United States and developing social structures, profiles of cities that demonstrate either high or low rates of violent crime. In addition to publishing numerous journal articles, book chapters, he has co-edited 2 books and is the founding editor of Homicide Studies, an international and interdisciplinary journal. Please welcome Dr. Smith, and as always, go Bulls.
Serovich, thank you, and I appreciate the introduction. And let me join her in welcoming everyone here to the event this morning. And as you know, we're here to talk about mental health, violence, guns. This is a topic that's actually been around for some time. It hasn't received the national attention that it has received and is going to receive, I think, over the next several years. And part of that is because we've had some very high-profile incidents. There's some names that perhaps have faded a bit, but the event itself remains in the public conscious. So the name Peter Lanza will forever be connected to the Sandy Hook Elementary School shootings. James Holmes will always be remembered as the theater shooter in Aurora, Colorado. Swan Cho will always be known as the shooter at Virginia Tech. And very recently, Chris Harper Mercer will be known as the individual who entered and killed several of his classmates at Umpqua Community College in Oregon. But even though these are fairly recent, the fact is this is not a new problem. It's one that's been with us for some time. And it's interesting how probably so few of today's college students would remember the name of James Hinckley, whose parents had detailed in great anguish their discussion and their trials and tribulations with his mental health issues that ended up in probably every parent's absolute worst nightmare, probably beyond their worst nightmare, and that is the attempted assassination of President Reagan and the shooting and seriously wounding of several of his aides, including James Brady, who later began a crusade against handguns and had a bill, the Brady Bill, named for him. And maybe even before that. So a lot of you who are familiar with these names may not be familiar with the person named Howard Unruh. And I mention him because he does have a certain historical significance. Unruh was a military veteran, actually quite decorated during the war, and who returned home after having served in some really heavy combat areas. He was noted as being a bit odd, kept a detailed journal of every enemy soldier that he killed. Came home, moved in with his mother, and within short order began to clash and have disruptions with the neighbors around him. And this continued for some time, developed a reputation as being quite the odd duck in the neighborhood, and unquestionably became the object of taunting and teasing. He came home one night, having gone to a late-night movie, and found that the gate surrounding his house with the fence had been taken. Went to bed, got up early the next morning, had breakfast with his mother, got into fairly serious arguments, so much so that she left the house. After she left, Unruh apparently went in, got dressed, manicured himself, got his military-issued weapon, and started walking into the neighborhood in an incident that became known as Howard's Walk of Death. And as he walked through his Camden, New Jersey neighborhood, he shot 12 people, including 3 children. When police began to arrive, he retreated back to his home, and after a shootout with them, ultimately surrendered. The date of this event was September the 6th, 1949. Unruh was eventually diagnosed with paranoid schizophrenia by psychologists, was found to be insane, and was immune from criminal prosecution. He was sent to a psychiatric hospital where he served out the rest of his life in isolation. He died in 2009 after a lengthy illness at the age of 88. His last public words were spoken to a psychologist who he was being interviewed by, and his words were, "I'd have killed 1,000 if only I'd have had more bullets." So this is a problem clearly that's been with us for a while, and there were those who preceded Unruh. Unruh was historical in the sense that it was one of the first individual cases of a murder rampage that received widespread national attention. But it just goes to illustrate how long, to some extent, we've been grappling with this problem. And yet, for all the grappling that was done, the more recent incidents show that there is much work to be done. And that's going to be the topic of this morning's discussion. Just, I think last week, perhaps the week before that, a survey done by the University of South Florida, checking public opinion in the state of Florida, asked the question whether or not those who obtain handguns should be subject to a mental health background check. Overwhelmingly, nearly 85% said yes. Of course, what was not discussed was, well, how is that check supposed to take place? What kind of database would be necessary to make that happen? And did it apply to handguns only? Did it apply to rifles? So, said another way, as you can see, the devil is in the details. So this is an issue that in many respects is not subject to simplistic explanations nor to simplistic solutions. And that's why we're particularly pleased to have the distinguished panelists that we have this morning to discuss different aspects of this problem. And so the way we're going to organize it is we're going to ask each of the speakers to come up, give a presentation of roughly 15 minutes. We do have a monitor backstage, so if there's a tapping on your shoulder, don't jump. Just know that you have a couple of minutes where you need to wrap it up. And then we'll have about a 5-minute question and answer session afterwards, and then move to the next speaker. At the conclusion of all of our speakers, we'll have another question and answer session where we'll be taking questions from the audience. And then last, we will reserve some time at the end so that people who wish to make statements about their ideas for what can be done to address this issue can be articulated. So with that, we begin with our first speaker. We're very pleased to have with us Jeffrey Swanson, Professor of Psychiatry and Behavioral Sciences at Duke University School of Medicine. Dr. Swanson will be talking to us about thinking carefully about gun violence, mental illness, and the law, balancing risk and rights for effective policy. Dr. Swanson.
Thank you. Good morning, everyone, and thank you so much for coming. It's such a privilege for me to be a part of this important conversation here in Tampa today. And for the next few minutes, I'd like to invite you to join me in trying to think carefully about gun violence, mental illness, and the law. So we're going to talk about firearms-related injury and mortality, mental illness, untreated mental illness, and the law. What gun violence and mental illness have to do with each other, how they're not related necessarily, what we know about that scientifically, what we don't know, and maybe more importantly, what we think we know sometimes that ain't so, and how we might use that kind of understanding to find our way to some interventions and policies and laws that will meaningfully reduce the scourge of gun violence, but do so in a way that will balance risk and rights with respect to firearms access, because this is the country we live in. And we'll also do that in a way that will avoid adding to the burden of social rejection and stigma that people with mental illnesses often face when their neighbors assume that they are violent. We live in a country that celebrates guns, that has domesticated guns. We live in a country where private gun ownership is represented by very powerful corporate interests and political interests. We like guns in this country, and we have a heck of a lot of them. 310 million firearms in private hands. We also have a serious problem with gun violence. And Dr. Lozada is going to go into that in more detail. When do we tend to focus on it? When does it seep into our national conversation, into our consciousness? We tend to focus on gun violence when there's a horrifying mass casualty shooting by a disturbed young man. And all of these wrenching questions confront us again. Why did this happen? Couldn't somebody have predicted it and prevented it? What was it about? Was it about the guns, unregulated firearms in a system that was supposed to keep guns out of the hands of dangerous people, like a failed background check? Why did it happen? Was it about our violent culture? Or was it about mental illness? Disturbed individuals. And a lot of people seem to conclude that it's about mental illness. That's the problem. The problem is the motivation of a disturbed person, and that is what underlies gun violence. And we hear these prominent voices in the public square. Representative Tim Murphy, a congressman from Pennsylvania, explicitly linking gun violence to mental illness. And Congressman Murphy said recently, how many more must die before we finally deal with our broken mental health system? Well, I'm a mental health services and policy researcher. I've been working on this for many years, and I would love to do something about our fragmented, overburdened, underperforming mental health care system. I mean, it's not working very well for many people, and as a result, we have more people in our big city jails with serious mental illnesses than we ever had in the biggest asylum in the middle of the 20th century. And we have people waiting in emergency departments who can't get into a hospital bed because we don't have those available. And it is a scandal, and it's a disaster. It is costing our society $300 billion a year. But guess what? If we were to magically cure schizophrenia and bipolar disorder and depression tomorrow, that would be wonderful. But our gun violence problem would still be with us. Gun violence overall would go down by about 4%. If we're talking about violence against other people. Now, suicide is a little different story. Because the vast majority of people with serious mental illnesses are not violent and never will be. And the vast majority of the perpetrators of gun crimes do not have these serious mental illnesses that impair reasoning and judgment and mood regulation. They tend to be caused by all kinds of other things, this whole cocktail of factors like being young and male and using illicit substances and alcohol and being impulsively angry and the whole range of pathologies that are associated with poverty, social pathologies. Being exposed to violence, childhood victimization, when people are growing up and trying to formulate an intact personality and they're being beat up. A lot of those kids can grow up to be perpetrators. So it's complicated, all of these things. Here are some data recently published, a new analysis of data from the MacArthur Violence Risk Assessment Study. This is data on about 1,000 patients who were admitted to an acute psychiatric admission with serious mental illnesses and followed in the community for a year after that. 28% of them, 262 out of the 951, did something violent, some minor or serious act of violence. Could have been pushing or shoving somebody, not necessarily causing an injury. And of that, 28%, that's 262, a much smaller number used a gun. 23 used a firearm. Now, they didn't necessarily shoot somebody, but they used a gun in a way that was threatening or harmful. And of that group, 9 individuals used a firearm against a stranger. Okay, so you've got 1,000 people followed for a year, and these are people, not just a random sample of people with mental illnesses, but people who were so seriously ill and had to be allowed and involuntarily committed, admitted to a hospital. So it's a select group, followed for a year, 2% of them did something violent with a gun. Now that's actually a high relative risk. It's about 3 times higher than the general population. But if you were to use that information to predict that somebody who's been admitted to a hospital who has a serious mental illness and followed for a year, they're going to be violent with a gun, you'd be wrong 98% of the time. Well, because only 2% are. So can you predict mass shootings? Can you predict these events? Well, of course you can. I can do this. I'm a professor. I know all about how to do this, and I'm going to tell you, you can kind of do it too. All you need is this remarkable device called a retrospectoscope. Now you take this retrospectoscope, and it's amazing what you can see from this thing, okay? Right, so, this is what you got just without that. Here's a mass shooter. It's kind of foggy. It's kind of, it's really kind of unclear. What are we looking at? This is a very irrational, disturbing act, and we don't know what it is. Now you take the retrospectoscope, you look at it, and it sharpens right up there, okay? Now you've got a picture of an angry, alienated, isolated, emotionally unstable young man. Perfect. We're going to take that lens, we're going to flip it around, point it out into the future prospectively at the population, and we're going to find that guy and make sure he can't have a gun. Okay, so here we go. There we are. Okay, you see him there? You see the guy we're looking for? Maybe he's over there. Maybe he's over there. The thing is, that picture matches the description of tens of thousands of other angry, alienated, troubled young men who are not going to do that. So that's the problem. You can't find that needle in the haystack very easily. Maybe we need to focus on the haystack. Now, the problem with trying to use the law, in this country, we can't do what some of our peer countries do, which is to broadly limit legal access to guns because of the way the United States Supreme Court has interpreted the Second Amendment to the Constitution, that it confers an individual right to own a gun. Now, it's not an unlimited right, so we have to try to struggle with that and figure out who are the dangerous people who have such a high risk of harming others and themselves that they should not have access to a gun. That's so hard to do because violence is complicated, people are complicated. But we've got these 3 intersecting circles here. We've got interpersonal violence. People are going to be violent towards others. They shouldn't have a gun. People are suicidal. That's over half of the fire fatalities. They shouldn't have a gun. And we have mental illness. Now, the law that we have that we've inherited from the 1968 Gun Control Act and the Brady Law does this with respect to mental illness. Involuntary commitment, a history of a mental health adjudication. You can see there, these circles are not isomorphic, because you've got that right there in the middle. It's too broad and too narrow at the same time. These restrictions tend to identify lots of people who are not violent and never will be, and they fail to identify some who actually are. We need to sharpen those criteria, and we could do that in a way that would not run afoul of the Second Amendment. If we focus more on risk, actual behavioral indicators of risk, history of violence, which is a far better predictor of violence, future violence, than mental illnesses. So do background checks work? What data do we have about this? Well, here's a study we did in the state of Connecticut, published a couple of years ago. You see 2 trend lines here, the red and the blue. The red line represents the risk of violent crime with a gun, month by month by month, over a 10-year period of time, for these people with serious mental illnesses. And the red line are people who legally cannot have a gun because they've been involuntarily committed. So they should not be able to have a gun according to federal law as it's mirrored in Connecticut state law. The blue line are their counterparts. They're people with the same serious mental illnesses in the same mental health care system. But they can legally buy a gun because they've been admitted to the hospital voluntarily. So they do not have a gun disqualifying history of involuntary commitment. Now you see that the red line is higher until you get to about 2007. Now you expect that if you thought that the law was not being enforced very well because the criteria for involuntary commitment are intertwined with dangerousness. But something happens in 2007, the 2 lines converge. What happened? Well, this is what we call in the business a policy shot. Connecticut all of a sudden deposited thousands and thousands of these gun disqualifying records into the National Instant Criminal Background Check System. So after that period of time, somebody couldn't just go in and lie and buy. They are going to fail the background check system. So you look at that, you say, wow, that probably looks like that worked. But here's some maybe a little less good news. Turns out that only 7% of this population were disqualified due to this mental health adjudication. And meanwhile, 96% of the violent crimes among these people were committed by those not affected by that disqualification. And what were the factors that predicted violence in this population? Well, they were the same things that predict violence in other populations. Being young and disadvantaged and misusing drugs and alcohol. So it's like you have a good vaccine, but you only vaccinate